Describe your experience caring for patients from diverse cultural, religious, or ethnic backgrounds. How do you provide culturally sensitive care?
Throughout my nursing career, I have cared for patients from a wide range of cultural, religious, and ethnic backgrounds, each with unique beliefs, communication styles, and healthcare expectations. I view culturally sensitive care as essential to building trust, promoting compliance, and delivering holistic nursing that respects the individual's values and needs. In one situation, I cared for a patient whose religious beliefs required modesty and specific dietary practices during hospitalization. The task was to provide necessary medical interventions while respecting their cultural and spiritual preferences. I took action by first asking the patient about their needs and beliefs, consulting hospital policy and dietary services, and coordinating with a multidisciplinary team. I ensured privacy during examinations, requested gender-concordant staff where possible, and arranged meals that adhered to dietary restrictions. I also provided explanations for procedures in a culturally sensitive manner, avoiding jargon, and allowed time for questions, showing respect for their perspectives. As a result, the patient expressed comfort and satisfaction, cooperated fully with care, and experienced reduced stress during hospitalization. My team also gained insight into culturally sensitive practices, which improved care for other patients with similar needs. In general, I provide culturally sensitive care by actively listening, asking about preferences, avoiding assumptions, respecting religious and cultural practices, and advocating for adaptations when necessary. I also reflect on my own biases, seek guidance when uncertain, and strive to create an inclusive environment that values diversity, which ultimately enhances patient safety, satisfaction, and health outcomes.
This unit can be very busy and stressful. How do you manage stress and prevent burnout?
Working in a high-acuity, fast-paced environment can indeed be challenging, but I have developed strategies to manage stress and maintain resilience, ensuring that patient care remains safe and effective. I view stress management as both a personal and professional responsibility, combining practical time management, emotional regulation, and proactive self-care. In one situation, during a particularly busy shift in a 32-bed medical surgical ward, several patients required urgent intervention simultaneously, including post-operative care, pain management, and rapid assessment of a deteriorating patient. The task was to prioritize care effectively while maintaining my own composure. I took action by using structured prioritization tools, such as the ABC framework and patient acuity scoring, to focus on the most critical tasks first. I delegated non-urgent responsibilities to colleagues, communicated clearly with the team, and used brief mindfulness techniques, such as controlled breathing during short breaks, to maintain focus and emotional balance. As a result, all patients received timely, safe care, and I remained composed, avoiding errors despite the high-pressure situation. Beyond individual shifts, I actively prevent burnout by maintaining a healthy work-life balance, engaging in regular physical activity, reflecting on challenging experiences, and seeking support from peers or supervisors when needed. I also participate in continuous professional development and team debriefings, which help normalize stress and provide coping strategies. Overall, managing stress effectively allows me to provide consistent, high-quality care, model calmness for colleagues, and sustain long-term professional resilience. I believe that acknowledging stress, planning strategically, and prioritizing self-care are essential skills for any nurse in a demanding unit.
You're caring for a patient who is confused and trying to get out of bed. What interventions would you implement to keep them safe?
Patient safety is always my top priority, and managing a confused or disoriented patient requires a combination of vigilance, proactive assessment, and compassionate intervention. In such situations, I aim to prevent falls and injuries while preserving the patient's dignity and autonomy. In one situation, I was caring for an elderly post-operative patient experiencing delirium, who repeatedly attempted to leave the bed unsafely. The task was to prevent falls and potential harm without causing additional distress. I took action by first performing a rapid risk assessment, ensuring the bed breaks were engaged, the call bell was within reach, and the environment was free of obstacles. I remained at the bedside to offer reassurance, explaining in simple language why it was important to stay in bed temporarily. I also employed non-restraint interventions recommended in our hospital protocol, such as involving the family to sit with a patient and using frequent scheduled orientation checks. Additionally, I coordinated with a multidisciplinary team, including a physician and physiotherapist, to assess mobility needs, optimize pain control, and address possible contributors to confusion, such as electrolyte imbalance or medication side effects. As a result, the patient remained safe, avoided falls, and their agitation decreased with consistent reassurance and engagement. By documenting all interventions and communicating with colleagues during handover, we ensured continuity of care and maintained a safe environment throughout the shift. I believe that managing confused patients requires continuous observation, clear communication, environmental safety measures, and a patient-centered approach that balances protection with respect for autonomy.
You suspect a patient is being abused at home. What are your responsibilities?
As a nurse, safeguarding vulnerable patients is a fundamental responsibility, and recognizing potential abuse is critical to protecting their well-being. My role involves observation, documentation, reporting, and ensuring the patient's immediate safety while following legal and organizational protocols. In one situation, I noticed bruises on a patient's arms and inconsistent explanations about their origin. The task was to act appropriately to safeguard the patient without causing further risk or distress. I took action by first ensuring the patient was in a safe environment and engaging them in a calm, private conversation to gather information sensitively using open-ended questions. I documented all findings factually, including the appearance, location, and patient statements, avoiding assumptions or judgments. I then escalated my concerns promptly to the safeguarding lead and the physician, following hospital policy, and ensured that the patient was aware of available support services. I also coordinated with social work to initiate a safeguarding assessment, ensuring a multidisciplinary response. As a result, the patient received further evaluation and protective interventions, and a safe care plan was established. This experience reinforced the importance of vigilance, thorough documentation, and clear communication when addressing suspected abuse. I understand that my responsibilities include recognizing warning signs, reporting concerns through proper channels, maintaining confidentiality, and advocating for the patient's safety. It is essential to balance professional duty with sensitivity, empowering the patient while ensuring legal and ethical obligations are met.
A patient with a do not resuscitate DNR order goes into cardiac arrest. What do you do?
A DNR order is a legally and ethically binding directive indicating that the patient has chosen not to receive cardiopulmonary resuscitation in the event of cardiac arrest. My immediate responsibility is to respect the patient's wishes while providing all other appropriate supportive care and ensuring patient safety and dignity. In one situation, a patient with advanced heart failure and a clearly documented DNR order became unresponsive during my shift. The task was to manage the event in accordance with a DNR while ensuring accurate communication and safe care. I immediately assessed the patient's vital signs and confirmed the cardiac arrest, then refrained from initiating CPR or defibrillation, consistent with the documented DNR directive. I ensured the patient remained comfortable, administered oxygen as appropriate, and maintained airway patency. I promptly called the attending physician and the rapid response team to inform them of the situation and coordinate next steps. Meanwhile, I provided emotional support and clear information to the family, ensuring they understood that the care plan honored the patient's wishes. As a result, the patient's dignity was maintained, the family felt supported, and the event was documented clearly, including the DNR status, interventions provided, and communications with a medical team. This experience reinforced the importance of knowing patients' advance directives, clarifying orders during handovers, and acting confidently and ethically under pressure.
How do you stay current with the latest evidence-based practices in medical nursing?
Staying current with evidence-based practices is essential to delivering safe, effective, and high-quality patient care. I believe nursing is a constantly evolving profession, and keeping up to date requires a combination of continuous education, clinical reflection, and active engagement with current research. In my daily practice, I integrate evidence-based care by regularly reviewing updated clinical guidelines from recognized authorities such as the World Health Organization, WHO, the National Institute for Health and Care Excellence, NICE, and relevant professional nursing bodies. I subscribe to peer-reviewed nursing journals and participate in hospital-led clinical audits and continuing professional development, CPD sessions. These activities allow me to evaluate the latest evidence and apply it appropriately in practice. For example, In one situation, our unit revised its protocol for pressure injury prevention. The task was to implement the new evidence-based recommendations effectively across the ward. I took action by attending the in-service training session, reviewing recent studies on repositioning frequency and advanced dressing materials, and sharing updated practices during handover and ward meetings. I also helped develop a quick reference guide for staff to ensure consistent application of the new protocol. As a result, the incidence of pressure injuries in our ward decreased significantly, and compliance with prevention measures improved across shifts. This experience reinforced the importance of bridging research and practice through collaboration and education. I also make use of e-learning platforms and webinars, particularly those focused on critical updates in medication safety, infection control, and chronic disease management. Reflecting on clinical experiences and participating in case discussions further help me apply theory to practice, ensuring that my care remains both current and evidence-based.
Describe a time you received constructive criticism. How did you respond? And what did you do with that feedback?
Constructive criticism is an important part of professional growth in nursing, and I view it as an opportunity to improve both my clinical practice and communication skills. One instance that stands out occurred early in my career when I was working on a busy medical surgical unit. The situation involved a patient discharge where I had completed the clinical documentation but had not double-checked the medication reconciliation before sending the file for physician approval. My senior nurse noticed the omission and pointed it out during the shift debrief. The task was to ensure complete and accurate discharge documentation while accepting feedback professionally. Initially, I felt disappointed in myself, but I chose to listen actively, acknowledge the oversight, and thank my senior for bringing it to my attention rather than becoming defensive. As an action, I reviewed the discharge policy in detail and asked my mentor to observe my next few discharges to ensure I was following the correct process. I also created a simple personal checklist that included medication verification, care summary, and patient education notes, which helped me maintain accuracy under time pressure. As a result, my documentation accuracy improved significantly, and my senior nurse later commended my progress and proactive approach to learning. This experience taught me that constructive criticism, when received with openness, can lead to meaningful professional development. Now, I actively seek feedback from colleagues and supervisors, especially after complex cases, because I believe continuous improvement is vital in maintaining high standards of patient care.
What does professional accountability mean to you in your daily nursing practice?
To me, professional accountability means taking full responsibility for my actions, decisions, and the quality of care I provide to patients. It involves practicing within my scope, adhering to evidence-based standards, and maintaining the trust placed in me by patients, colleagues, and the profession. Accountability is not just about doing the right thing. It's about being transparent, reflective, and consistent in upholding ethical and professional standards every day. In one situation, I was administering medications on a busy morning shift when I noticed that a patient's dose on the electronic chart did not match the physician's most recent order. The task was to ensure the patient received the correct medication safely, despite the documentation discrepancy. I took action by holding the medication temporarily, double-checking the prescription with a physician, and reporting the documentation error to the pharmacist and nurse in charge. I then completed an incident report as per policy, reflecting accountability for patient safety and transparency in error prevention. As a result, the documentation error was corrected before administration, preventing a potential medication mistake. This incident reinforced for me that accountability means speaking up when something doesn't seem right, even when it's uncomfortable, and ensuring systems are improved to prevent future risks. I also demonstrate accountability through accurate record keeping, following infection control protocols, and engaging in continuous professional development to keep my knowledge current. When I make a mistake or identify an area for improvement, I reflect on it honestly and take steps to learn from the experience. Ultimately, professional accountability is about integrity, being answerable for one's actions, learning continuously, and ensuring that patient care is always safe, ethical, and of the highest standard.
How do you ensure you are practicing within your scope of practice, especially when transitioning to a new country with potentially different regulations?
Practicing within my scope is fundamental to ensuring patient safety, maintaining professional integrity, and upholding the standards of the nursing profession, particularly when working in a new healthcare system with different legal and clinical frameworks. My approach is guided by a commitment to learning, awareness, and adherence to regulatory standards. When I transition to a new healthcare environment, I recognize that while core nursing principles remain universal, the scope of practice, including delegation boundaries, documentation standards, and medication administration policies, can vary significantly. My first task was to understand these differences thoroughly. I took action by reviewing the local nursing regulatory body's code of conduct, hospital policies, and clinical practice guidelines. I also sought clarification from my preceptor and senior colleagues whenever I encountered unfamiliar procedures or protocols. For example, during my orientation period, I encountered a situation where nurses were responsible for managing for medications that, in my previous country, were typically administered by physicians. Before proceeding, I verified the local guidelines, completed the required competency assessment, and ensured I was adequately trained and authorized to perform the task. As a result, I was able to deliver care safely, within my professional boundaries, while building confidence in adapting to the new system. This approach also helped prevent potential errors and reinforce trust with my team. I believe accountability in a new country begins with humility, recognizing what you don't yet know, and taking proactive steps to bridge that gap through education, mentorship, and open communication. I also maintain professional registration requirements, attend ongoing competency updates, and reflect regularly on my practice to ensure compliance with both legal and ethical expectations.
Can you tell us about a time you went above and beyond for a patient or their family?
Going above and beyond in nursing means recognizing that care extends beyond medical treatment. It includes compassion, empathy, and a genuine commitment to a patient's emotional and psychological well-being. One memorable experience that reflects this occurred while I was working on a medical ward with an elderly patient who was terminally ill and had no immediate family nearby. The situation was that the patient was nearing end of life and had become withdrawn and anxious, frequently expressing fear of dying alone. The task was not only to manage their clinical comfort, but also to provide emotional support and dignity during their final days. Despite a busy shift, I made a conscious action to spend extra time with the patient, sitting beside them, listening to their stories, and reassuring them that they were not alone. I coordinated with a multidisciplinary team to involve palliative care, ensured optimal pain management, and arranged for a volunteer chaplain to visit daily for spiritual support. On my own time, I even arranged a video call with a patient's distant relatives so they could say their goodbyes, as travel was not possible. As a result, the patient became more peaceful, expressing gratitude for the care and comfort received. The family later sent a letter of appreciation, acknowledging how meaningful those final interactions had been. This experience reaffirmed for me that nursing is not just about treating illness. It's about providing holistic care that honors human dignity, even in the most vulnerable moments.
A patient with COPD is on 2 liters per minute of oxygen via nasal prongs. Their respiratory rate increases, and they become drowsy. What is your concern and what would you do?
This scenario raises an immediate concern for CO2 retention and impending type 2 respiratory failure, which can occur in COPD patients when their hypoxic drive to breathe is suppressed by excessive oxygen administration. The combination of increased respiratory rate and new-onset drowsiness is a red flag for deteriorating gas exchange and rising carbon dioxide levels, hypercapnia. In this situation, while working in a respiratory unit, I once had a patient with severe COPD on low-flow oxygen who suddenly became lethargic and tachypneic. The task was to recognize and respond quickly to prevent further deterioration. My immediate actions were to stay with the patient, assess airway patency, and check vital signs, including oxygen saturation, respiratory rate, and level of consciousness. I also reduced the oxygen flow to maintain saturations between 88 and 92%, the recommended target range for COPD patients, to avoid worsening hypercapnia. Next, I alerted the rapid response or medical emergency team and informed the attending physician of the patient's change in condition. I prepared for an urgent arterial blood gas (ABG) analysis to confirm CO2 retention and assisted in setting up non-invasive ventilation (NIV), such as BiPAP as prescribed. Throughout this, I closely monitored oxygen saturation, mental status, and vital signs, and reassured the patient to reduce anxiety and energy expenditure. As a result, early recognition and timely intervention helped stabilize the patient's condition, preventing the need for invasive ventilation. The ABG confirmed elevated CO2, and the patient improved significantly after starting NIV and adjusting oxygen levels appropriately. This experience reinforced the importance of critical thinking and vigilance in managing COPD patients, understanding the balance between oxygen therapy and the risk of respiratory depression.
How would you manage a patient with a new diagnosis of type 2 diabetes, focusing on education and discharge planning?
Managing a patient newly diagnosed with type 2 diabetes requires a holistic approach that integrates patient education, lifestyle modification, medication adherence, and emotional support. My focus is always to empower the patient with knowledge and confidence to manage their condition safely after discharge. In one situation, I cared for a 55-year-old patient newly diagnosed with type 2 diabetes following an episode of hyperglycemia. The task was to prepare the patient for discharge with comprehensive education on self-management and follow-up care. I began by assessing their baseline understanding, health literacy level, and any concerns they had about the diagnosis. I took action by explaining the nature of diabetes in simple, non-medical language, emphasizing how high blood sugar affects the body and why medication, diet, and exercise are equally important. I then demonstrated blood glucose monitoring using a glucometer and allowed the patient to practice under supervision. I provided written materials and a daily logbook to record readings. I collaborated with a dietitian to create a personalized meal plan, highlighting portion control, balanced carbohydrate intake, and reading food labels. The pharmacist reviewed medication use, including possible side effects and the importance of timing. I also taught the patient how to recognize and manage hypoglycemia and when to seek medical help. Before discharge, I reviewed their follow-up schedule, ensuring they had appointments with a diabetes educator and primary care provider. I also encouraged family involvement to support lifestyle changes at home. As a result, the patient expressed confidence in monitoring blood glucose and understanding medication routines. During follow-up, their blood sugar levels showed steady improvement, and they adhered well to dietary advice.
Describe the nursing care and monitoring for a patient with acute kidney injury, AKI.
Caring for a patient with acute kidney injury, AKI, requires meticulous monitoring, fluid balance management, and prevention of further renal damage through evidence-based nursing interventions. My approach focuses on early detection of complications, maintaining homeostasis, and ensuring collaborative multidisciplinary care. In one situation, I managed a 68-year-old postoperative patient who developed AKI due to hypovolemia secondary to sepsis. The task was to stabilize renal function, prevent further decline, and closely monitor fluid and electrolyte balance. My first action was to conduct a thorough assessment, monitoring vital signs, urine output, daily weights, and fluid intake meticulously. I used a strict input-output chart, ensuring the urinary catheter remained patent and aseptic. I monitored urine output hourly, as even small decreases were significant indicators of worsening renal function. Blood results such as creatinine, urea, potassium, and sodium were reviewed promptly, and I reported any critical trends to the medical team. To prevent fluid overload, I assessed for signs of pulmonary edema, such as crackles, dyspnea, or raised JVP, and adjusted fluid administration according to prescribed plans. Medication management was another crucial part of my care. I ensured nephrotoxic drugs, like NSAIDs and certain antibiotics, were withheld or administered only after consulting the physician. Electrolyte imbalances, particularly hyperkalemia, were managed promptly through collaboration with a medical team for ECG monitoring and appropriate pharmacological intervention. Nutritional support was coordinated with a dietitian to reduce protein waste products while maintaining energy requirements. I also provided psychological reassurance to the patient and family, as the sudden diagnosis often causes anxiety. As a result, the patient's urine output gradually improved, serum creatinine levels stabilized, and renal recovery occurred without the need for dialysis.